This is the last one I'm going to look at for adverse reactions to a COVID vaccine. The paper starts off by saying that it's well known that a COVID vaccine results in a significant decline in COVID-19 morbidity and a decrease in mortality rates, stating that in rare cases you can have cardiovascular complications and some cases of high blood pressure have been reported. Where these cases are occurring in young people, a lot of times when the mRNA vaccine is given inappropriately, and by this they mean when you are just getting over a COVID infection, so your body is still healing, so you're taking this part where, or this time period where a person's immune system is sort of damaged and hurt, and then you're adding insult to injury by giving them a vaccine as well during that time. So you should give them a healing period, probably a couple weeks, maybe even a month after getting COVID to actually get a vaccine. That would be less likely to cause issues. And that this is also problematic for people that have a history of cardiovascular disease, where the paper is looking at AstraZeneca, Johnson & Johnson, the two ones where they had the issue, Pfizer Biotech, and then Moderna, where these guys got pulled from the market because of a rare complication of thrombocytopenia and thromboembolic events. So the authors of this review paper are basically saying their hypothesis is that, all right, so you have these blood clotting issues for these individuals. You should just provide a short course of anticoagulant treatment, and then this probably will help protect against these adverse effects for vaccinated people. So looking into the high blood pressure, out of 92,000 reports, about 1,000 cases had hypertension, that high blood pressure, as an adverse drug reaction with the COVID-19 vaccine for the Pfizer. And another study was sort of showing that tachycardia was reported by 13% of individuals that got the Pfizer vaccine, with one study for the Pfizer vaccine showing that some people got tachycardia, about 13% of 113 people in that study, with these symptoms like high blood pressure occurring for about 3 or 4 days after vaccination. And they found that if you have adverse reactions with the first vaccine, you will also probably have adverse reactions with the second. But again, this is quite rare. 7 people reported this out of 797 in this study, with the most common adverse effects being redness around the injection site, pain and swelling around the injection site, tiredness, fever, chills, headache. But an interesting point is that alcohol consumption can result in an increased risk of these adverse reactions. So make sure that you're not drinking alcohol when you are getting vaccinated or after you are getting vaccinated, as this has been known to generate issues.